Good morning. We are ready to continue our journey. Chapter 4, Infection Prevention. We are towards the end of week 2, so we have 3 more weeks to go, diving deep into medical microbiology. So let's get started. First things first, I want to make sure that all the discussion boards are done on time. So make sure that in your journey throughout this course that Wednesdays, your initial discussion board is posted, and that your secondary and tertiary post is completed by Sunday night. So this is every single week until the end, where you'll have to end at 5 p.m. instead of 11:59 p.m. Sunday. That's at the end of the course. So there is no reason for you to lose points that way. So make sure that you keep up with the work on time. All right. So now that I said that, let's begin our journey into chapter 4. This lesson, alongside taking notes and studying the PowerPoint, is definitely not enough. You need to read the chapter and take notes from there as well. That's the best way. Read, write, and hear it and see it. So here's a lot of material to cover. So this here is just the highlights. All right. So how do we prevent infections? First of all, we need to understand the organism. So understanding the organism, how it works, and we've created, terminology that is the language of microbiology. So we need to know the chain of infection, how it began. You need to know the different types of organisms, whether they create spores or not. They could be vegetative organisms. And then what does it mean to be denatured? So denaturing a protein renders it useless. Well, that's the same thing that's going to happen if we do that to pathogens. So in this introduction to chapter 4, we will be reviewing how something becomes contaminated with potential pathogens, how one gets an infection, what is a nosocomial infection, that is a hospital-acquired infection, and how do we prevent that, since you will all be medical professionals and you will be working in a hospital setting. So you really need to make sure not just that the instruments are sterile, but the environment that you're in is disinfected. There's a difference between disinfection versus sterility. The operating room is obviously a sterile space, but you also need to disinfect. Doesn't mean that there aren't any organisms, but the count is really low. The actual surgical instruments must be completely sterilized. So there's a difference between cleaning, sanitation, disinfection, and sterility. Decontamination versus sterility. So there's levels of cleanliness, right? So you go from a room being clean to a room being sanitary, meaning less organisms, to decontamination, killing organisms, and disinfecting with the use of disinfection products, and then all-out sterilization, wiping out the organisms. So what issues do we have, and what issues do we consider when killing an organism? We want to focus on A, the type of organism that we are hitting, and how do we hit it, because some organisms have spores. So you're going to obviously have to penetrate that spore to be able to kill it, right? So definitely the type of organism, the number of organisms, okay? And of course, the type of agent that we're using for infectious control, okay? The strength of the killing agent is also important. For example, using peroxide versus alcohol versus vinegar are different levels of disinfection. All right. And of course, the time it takes to kill an organism, the amount of exposure time is super important. And then you also have to consider the environmental issues and what is the effect on the environment should you be using a product to kill a pathogen. All right. And then, of course, elaborating on temperature, the environmental space that you are in, what temperature does it take to actually kill the organism? So the methods used to disinfect and sterilize are listed right here for you. Of course, I'm just providing you a list. You need to read. There's so many ways to kill organisms via heat, right? So, right off the bat, boiling, right? But then there's also pasteurization, right? And then there's utilizing steam and pressure. That's your typical autoclave that you use in private offices and clinical sites, okay? So we use water, purified water, or distilled water, I should say, not purified water, distilled water. We steam it and we do high pressure, and this is how we sterilize the organisms. Unfortunately, the instruments, after many, many years, maybe not even after 3 years, depending on the quality of the metal, might become rusted from all the steam that rises up from this procedure. All right, then we could also use liquids and compounds. So typically in a doctor's office, we first scrub with a wire type of brush the blood. Let's say we were using surgical instruments, a minor surgical procedure, example, excision of a nail. Because I was a podiatrist, I just always think of that. My go-to, right? So, partial removal, nail avulsion, due to a paronychia. So what do? Obviously, the nail was removed. There's probably a little blood involved, definitely some infection there. You scrub it. You, after that, you wash it with water, and then you let it sit for 24 hours in a particular liquid, which we'll go into. There's different types of chemicals that will disinfect. Okay, but that's not enough. So what do we do next? Then we put the instruments, we wash again, air dry, and then put the instruments in an autoclave at high steam and pressure. And this is how we can completely sterilize the instruments to be used again. All right. We can also use radiation. This is another method of irradiating organisms and removing them from the surface. Now, let's start with the first one, heat, which is the most common. High temperatures are required. The good news is it's less time for disinfection. Like, for example, if you're doing a chemical, it's over 24, sometimes even 72 hours, depending on the chemical, how long you're going to keep the instruments in there. So heat will denature the proteins, which then lead to cellular coagulation, which leads to death. So that's how it works with the pathogens. The cell wall and the structure of the, whether it's a DNA or RNA of the pathogen, will denature and die. So now we have two methods. We can do moist or dry. So we talked about high pressure and steam, which is moist, but dry heat is basically something that we like to use when we don't want the moist heat to damage whatever product that you're using to sterilize. So examples of this would be oils, powders, and dressings. You don't want dressings to get wet, all right? But you want to have sterile dressings to use on open wounds that are deep, or surgical post-op incisions, things like that, okay? All right, and we can use dry heat on glass. So that's a very common way to utilize heat, okay? Now let's talk about moist heat. So moist heat, we have steam, which is more effective if it's at high pressure. So think of the autoclave that we use in an office, very common. We also utilize incineration. This will destroy and sterilize the objects. It will destroy all pathogens, but it will also destroy, of course, the actual object. It'll sterilize it, but probably destroy it. So when do we want to use this? Well, if we have had a one-time usage of a particular instrument that is not reusable, or like a patient's belongings that, was a severe contaminated, very contagious infection, and you want to incinerate. All right, so that's incineration versus moist heat. Now, let's talk about pasteurization. So pasteurization is honestly a very common way to deal with food so that we don't contaminate, or I should say decontaminate the food. This is the way we pasteurize milk, so that when you're drinking the milk, you don't get severe diarrhea and sickness from the bacteria that is naturally found in the milk. So we pasteurize milk. Okay, so how does this work? It's heated water. It kills the vegetative cells. It'll denature most viruses. And if it's used for instruments, we immerse the instruments in about 70 degrees Celsius water for 30 minutes. Then we air dry, and then we package in a sterile manner. So that's one way to sterilize your instruments, pasteurization. Now, boiling water will kill most bacteria. Unfortunately, it'll only inactivate the viruses. Not only that, not only does it not kill the viruses, it really only just, inactivates them for about 15 minutes. So that's a big problem. I noticed, I don't know who posted on the DB that that's your go-to. Yeah, it is your go-to if you're worried about bacteria, but it's really not a comprehensive way to kill all pathogens, because it really doesn't affect viruses. So therefore, boiling water, yeah, they did it in the 1700s, 1800s, 1900s. All right, but it doesn't kill all pathogens. And of course, let me go further beyond the viruses and tell you that some bacteria ineffective, obviously because they have a spore. And then, of course, fungus completely ineffective because they have spores. All right. The wonderful thing about boiling water is that it is cost effective, and you could utilize it if you have nothing else. All right. Take a little bit of a risk, but something is better than nothing, right? Now, take note that there is a difference when you go at altitude. So for every 1,000 foot increase in altitude, you need to increase the boiling time by 5 minutes. Okay, now let's go over steam and pressure, which is a very effective sterilization method. This is utilized, as I mentioned, in clinical settings and private physicians' offices. Autoclave is combining the use of steam and pressure. That's what an autoclave is. All right, so remember the definition. Autoclave combines the use of steam and pressure. The autoclave use is basically this. You package the instruments with a heat-sensitive indicator, which determines whether the sterilization was complete and sufficient. It kills bacteria, fungus, and spores, and it will denature viruses. Yay! So, ergo, this is why everyone uses the autoclave. All right, now what's the disadvantage of the autoclave? Can't be used for oils, can't be used for waxes, cannot be used for plastic or rubber. And as I mentioned, if you use it for many, many times, it will corrode metals and eventually rust. All right, now let's go over liquids and compounds. We have alcohol, acetic acid, phenol, chlorine, hydrogen peroxide, quaternary ammonium compounds, and glutaraldehydes. So obviously the go-to at home, very easy to get and very cheap, is alcohol. So is hydrogen peroxide. Be aware, hydrogen peroxide is pretty caustic, so you don't want to use it on wounds that are still very inflamed and fragile, or someone who's got a diabetic wound like an ulcer. Not a good idea. You need to, if you're going to use peroxide, dilute it. All right, it is caustic. All you need to do is take a cotton cloth, put peroxide directly on it, and you'll see it burn a hole through it. Okay. Now let's go over these. Alcohol. Alcohol will disorganize the lipid structure of the cell membrane, so very good for gram-positive bacteria and gram-negative, as well as acid-fast bacteria, which we talked about in chapter 3. It denatures cellular proteins. Unfortunately, it's not sporicidal. It will not kill the spores, and it will irritate the skin. So that's alcohol. Now, it may damage plastic and rubber. Two things you need to remember. We have two kinds of alcohol, ethanol and isopropyl alcohol. So ethanol is also AKA ethyl alcohol, most effective at 70% concentration. And then isopropyl alcohol, which is most effective at 90% concentration. All right, so when you go to the pharmacy and you get alcohol, make sure you know what you're getting. Ethanol is obviously, you don't need such a high concentration for it to be effective. I don't know if you know this, but isopropyl alcohol is probably the one that you're going to see at your CVS and Walgreens and all that. All right, next one is acetic acid. Lots of cleaners, house cleaners do this, housekeeping. They love to use acetic acid because it doesn't damage kitchen surfaces and things like that. All right, so acetic acid can be found in your good old-fashioned vinegar that is used in the kitchen. It is used, obviously, you all know, as a food preservative, and it inhibits the growth of many bacteria and fungi. The acidity will denature the cell's proteins. White distilled vinegar is the preferred method to denature the cell's proteins. And as I said, it is effective against many bacteria and fungi. So if you want to purchase vinegar in large amounts to clean around the house, I think that's a great idea. Just be aware that there is a smell to it. Next are the phenols. Phenol is actually used in procedures. We use a phenol and alcohol matrixectomy to denature and actually cause the cell membrane to denature and kill the cells that grow an ingrown toenail. So that's a very common podiatric procedure. But why do we use phenols to disinfect? Because it causes cell leakage. It inactivates the enzymes in the cell membrane. It will kill viruses. Unfortunately, though, it is not sporicidal. And the most common use is cleaning instruments and general housekeeping. It is quite caustic, so be aware that it is quite caustic. And so, you know, keep it away from your skin. It will burn your skin. And be aware that if it is caustic, certain surfaces might be destroyed. Okay, next one is chlorine. You can get it in the gaseous form or you can get it in the liquid form. It's effective against most bacteria, viruses, and fungi. It is not sporicidal at room temperature. Very corrosive to some metals. It cannot be used on rubber. And it is honestly not something you want to inhale. It is poison. You can get it in the form of hexachlorophene, which is chlorinated disinfectant without the chlorine smell. You can find these products in, for example, pool and jacuzzi cleaners, where you just have to take a little tiny teaspoon and it'll do the job because it is really potent. But unfortunately, like I said, at room temperature, it's not sporicidal, very corrosive to some metals. All right, the chlorine that we use is a very effective way to clean blood spills. You want to use in a ratio 1:10 solution. 1:50 solution is effective against gram-negative bacteria, bacterial spores, and Mycobacterium tuberculosis within 10-minute exposure time. So that's pretty amazing. Now, hydrogen peroxide. If we use it as a 3% solution. It is a great mild antiseptic for wound cleaning. Stronger than 3% may actually cause damage to the wound tissue. So obviously the hydrogen peroxide that you buy over the counter at CVS or Walgreens is perfectly safe for wounds. Typically, what I like to tell people is you put it in a spray bottle so that you don't lop on too much onto the wound. That does become a little bit caustic. And of course, you know, if it's a diabetic wound, you really need to be careful with the copious amounts of hydrogen peroxide because it does kill the cells in the wound, not just the bacteria. Okay, now what about 6% solution? This is actually bactericidal, virucidal, fungicidal within 10-minute exposure at room temperature. So that's pretty cool, right? And hydrogen peroxide, if you leave it on for 6-hour exposure, it will finally eventually tunnel through and penetrate the spores and kill the spores. Now, quaternary ammonium compounds. These are going to cause semi-permeability by the cell membrane, causing lysis and denaturing of the cell's proteins and therefore death. It is bactericidal, especially gram-positive cocci like Staphylococcus and Streptococcus. You know, ineffective though against bacterial spores and enteroviruses that cause severe diarrhea, hepatitis B, fungi, and other spores causing TB, for example, it is ineffective. Now let's talk about glutaraldehydes. Very, very common. You can get it in a gallon. This is found in most offices, most clinical settings. This is how we do it. After we had patient use of instruments, we first scrub and wash, and then we use glutaraldehydes. And then after that, we wash again, we air dry and put it in the autoclave. That's the protocol. So we soak the instruments to disinfect and sterilize the surgical instruments, usually bactericidal, tuberculocidal, fungicidal, virucidal, within 10 to 30-minute exposure. Okay, it is actually sporicidal within 10-hour exposure time. When I had my own private practice, if I closed at 5 p.m. or 7 p.m., what I did is all the instruments for the day were scrubbed, cleaned, air dried, and then all of them were soaked overnight in glutaraldehyde, because then we had 8 to 10-hour exposure time, and we were able, well, we kept it 10 hours, but the next morning we would obviously wait another hour or two, remove them, wash them again, air dry them, and then put them in an autoclave. Of course, you always have this routine every single day, so you have extra instruments that are already packaged in a sterile packaging. So that's how it works. If you've ever worked in an office, same for hospitals. You know, this is a common way to utilize disinfection. Step 1, glutaraldehydes. The action is interruption of the metabolism and reproduction of the microorganism. And the best part of it is you can soak the instruments for 10 hours and eventually even kill the spores. Now, be careful with glutaraldehydes. You need to wear gloves. It is very irritating to skin, mucous membranes, and eyes. Very caustic and will damage rubber and plastic, and can even damage steel. So it requires rinsing, drying, and proper packaging of the items after the soaking procedure took place, whether it was 10 hours or not. Now, the next one is gas sterilization with ethylene oxide. This interrupts the metabolism and reproduction of organisms. The sterilization will depend on the concentration of the gas, the humidity, the temperature, and the time. So gas sterilization requires an indicator tape placement in the package. It does not guarantee sterility. It does require use of a biological indicator, and it requires 24-hour airtime in a well-ventilated area. And yes, it is toxic to humans, gas sterilization. And so we move on now to radiation. So radiation, we can use UV light, We can use a UV light for an entire room. This is very common in the operating room. It is bactericidal and it will damage DNA, so not a good idea to be in the room when you're using the UV lamp. We can also use mercury vapor lamps to disinfect operating rooms and nurseries. Gamma irradiation is very effective. It has short wavelength of light. It ionizes water molecules. It inactivates DNA molecules. It will not generate excessive heat, and the items can be prepackaged and sealed, and it does, however, require 48 to 72 hours. And unfortunately, it will release chlorine gas, so this is very toxic to humans. You need to be out of there. All right, so that's pretty much our highlights of every possible way that we are currently using to disinfect and sterilize. The goal is to prevent infection from ever occurring in the first place so that we don't have hospital-acquired infections, which are called nosocomial infections. Second, to summarize, is that once the infection has occurred, the goal is to break the chain of infection, and the methods of disinfection sterilization will include all of the things that we've mentioned: heat, pasteurization, boiling point of water, steam and pressure, liquids, compounds, gas sterilization, and last but not least was radiation. All right, so I do hope you enjoyed this lesson today, and I will see you next time. Our next lesson will be entering week 3, chapter 5 and 6. All right. Bye.